Hello and welcome to our video channel Urology for Everyone. I am Dr. Girish Nelivigi, Urologist and Andrologist from Nelivigi Multispeciality and Urology Hospital, Bangalore. Today, I'll be talking on a condition called overactive bladder. This is a very common and distressing problem faced by many people. Now, what is overactive bladder and what are the symptoms of the patient? The patient could be a male or a female of any age group, and the common symptoms are urgency in urination. It means the patient has to visit the toilet urgently. If there is a delay in visiting the toilet, he or she may leak urine in the clothes. Also, the patient may complain of severe frequency of urination, which means he will visit the toilet about 8 to 10 times per day or more, and even in the night time there is a visit to the toilet of about 5 to 6 times or more. There could be associated pain while passing urine, and these symptoms can come after urinary infection or stone disease or enlargement of the prostate. By definition, overactive bladder is when we exclude all the causes, but for treatment's sake, the patients may come to us commonly after urine infection, or enlargement of the prostate may give rise to these symptoms, or even stones in the ureter or in the bladder may give rise to these symptoms. When the patient comes to us, we do some basic tests like physical examination, history taking, and also some basic investigations like urine examination to rule out infection, ultrasound of the abdomen to rule out stones in the urinary tract, and also to exclude or confirm enlarged prostate. Rarely, we may do some advanced tests like CT scan or urodynamic study, or sometimes a urine flow rate is also done, which is available in most of the urologist clinics. Once we diagnose overactive bladder, the treatment consists of lifestyle modifications, behavioral changes, and drug treatment. Lifestyle modifications include advice to restrict the intake of water and also dietary modifications, because we know that certain types of diets, especially those which contain high acid contents, are responsible for the symptoms of overactivity of the bladder. We also advise the patient to do some bladder training techniques and also some behavioral modifications so that the urination could be postponed. But most of the people will need some pharmacological management or a drug management to get relief from overactive bladder symptoms. Nowadays, the drug treatment for overactive bladder is very effective, and these consist of tablets which decrease the contraction of the urinary bladder. These are known as antimuscarinics, or there are beta-3 agonists also. Though basically they work on the receptors in the bladder to decrease bladder contraction. These drugs are given on a short-term to intermediate-term basis along with lifestyle modification and behavioral therapy. In case there is no symptom relief or there is minimal symptom relief with this therapy, then we go on to the next line of treatment. This is called Botox injection of the urinary bladder. So a cystoscopy is done, which is nothing but an endoscopy of the urinary bladder, and an injection called Botox is given in the wall of the urinary bladder, which decreases the contraction of the urinary bladder. This is helpful in a large number of patients, but the effect is short-lived. If nothing works, the more advanced treatments include nerve stimulation, either in the leg, that's called posterior tibial nerve stimulation, or in the spinal cord called sacral neuromodulation. These are advanced techniques which change the signal transmission in the nerve and the spinal cord to help a patient with the urinary bladder. So to conclude, the treatment of urinary bladder has advanced overactive bladder has advanced and the modern therapies are highly effective. So if you suffer from any of the symptoms of overactive bladder, you can visit a urologist for relief. Thank you for listening, and I'll be back with another video next time.